Hi everyone, this is Vicky from NP Reasoning, and today I'm going to talk to you about diagnostic frameworks. So, essentially, how to apply diagnostic frameworks to any clinical case that comes in front of you. There is no need to wing presentations when we see patients. We should essentially always be using some form of diagnostic framework to guide us through that presentation. So, again, we're going to learn how to create these diagnostic frameworks for common presentations. It's important to highlight that it's not a one size fits all. So, I'm going to present what types of frameworks you can use. And it's really about you experimenting and figuring out what frameworks work well for you given the current presentation in front of you. So, let's get into it. So, really, how do we create differential diagnoses, right? We're not winging it, we're not pulling things out of thin air. We use our knowledge base about disease and we create these diagnostic frameworks for various clinical presentations. So, the four common frameworks used in medicine are the systems framework, the mechanisms framework, the anatomic framework, and the checklist mnemonic framework. Again, really important to highlight that it's not a one size fits all. It's really up to you to figure out what framework works best in your brain to organize a case in front of you. And I'll go through many case examples of what I mean by this. So, first off, let's start with the systems framework. It's exactly how it sounds. It's about creating different buckets or systems that can cause different diseases based on the presentation. So, we think about the respiratory system, nervous system, endocrine system, skeletal system, etc. So, for our first case, let's say a 50-year-old male is presenting with a 3-month, so chronic history of bilateral pitting edema to the legs. Instead of just kind of randomly thinking up differentials, I want to make sure that I'm using differential buckets to tailor my history, physical exam, and differential. So, what I asked myself is what body systems can cause pitting edema? So, four key ones that I like to think through are the cardiac, endocrine, hepatic, and renal. And then that other bucket is really for things that don't fully fit, but there's some other random diagnoses that you wouldn't want to miss. So, thinking through this case, for our cardiac bucket, we're thinking of heart failure, restrictive pericarditis. For the endocrine system, we're thinking of thyroid disease, acromegaly, Cushing's disease or syndrome. For the hepatic system, we're thinking of liver disease, liver cirrhosis, certainly cause pitting edema. For the renal system, thinking of kidney failure, nephrotic syndrome, and then that other bucket, there's a few other things listed there as you can see. So, really, I have the chronic bilateral pitting edema. I'm thinking of my differential buckets based on that systems framework. And before I even lay eyes on that patient, I'm thinking through all of these possibilities because this framework, this layout, will help tailor my history and physical exam and tests to order. So it really helps you ensure that you're not missing key diagnoses, right? Let's think of a second example for the systems framework. Say a person's presenting with acute shortness of breath. So, what I'd like to think about is what body systems can cause shortness of breath, right? Certainly the cardiac system. So, we're thinking of heart failure, acute coronary syndrome, and arrhythmia, valvular disease. For respiratory system, we're thinking of a pulmonary embolism, of course, COPD, asthma, malignancy, pneumonia, etc. Hematologic, could it be an initial presentation of a severe anemia? And neurological, thinking of neuromuscular disorders like ALS. And then, of course, our other bucket, as you can see here. So, again, before I'm seeing that patient, I'm organizing my diagnoses or my differential diagnoses based on these bodily systems so I can tailor that differential as I assess.